Greetings. Hello, everyone. So great to see you here. I noticed one person in the chat box who said that you were not able to hear. So do please use that chat box, and Tiara can assist you. I'm Lisa Maynard, and I'm here today with my partner, Implementation Specialist Emily Smith-Garing. We both work for the Center for Adoption Support and Education based here in Burtonsville, Maryland. We are here today to share information with you about the National Adoption Competency Mental Health Training Initiative, which we call NTI because it's a whole lot shorter. So welcome to our presentation today, and we hope that you get lots of really good information and are as excited about this as we are.
Thanks, Lisa. NTI is a multi-year initiative funded through a cooperative agreement between CASE, the Center for Adoption Support and Education, and the U.S. Department of Health and Human Services Administration for Children and Families Children's Bureau. Over the last 5 years, we've been developing, evaluating, and refining our curriculum, and we're really proud to have produced 2 state-of-the-art, web-based, self-paced, and free training for child welfare and mental health professionals. This launches nationally on September 30th of this year, and that's what we're here to talk to you about today. We could not have done this alone. We have many partners and experts that have advised us along the way, and if you would like a complete listing of all those partners and advisors, please visit our website to learn more. Today, we will cover the following things on the webinar. First, we'll talk about the need for adoption competency. We'll then describe NTI. We'll talk about the evaluation that we've conducted, and then, of course, talk about national launch and how you can get involved and spend time for question and answers.
Adoptive parents report that competent mental health services are one of their greatest unmet needs, too frequently reporting practices that are ineffective or even harmful to their families. The American Academy of Pediatrics estimates that 30% of children in foster care have severe emotional, behavioral, and developmental problems. Adoptive families utilize clinical services at triple the rate reported by families formed by birth. Foster and adoptive parents reported 1/3 of their children had emotional problems, and about 40% had educational problems. So comments like these that you see up on the screen are not helpful to the youth or to the family, and in fact often do more harm than good. The need for adoption competent mental health services is critical to the success of these families. I love this photo. Parents want to know that the professionals they are working with have the knowledge, skills, and experience to meet the unique mental health challenges of children and families in foster, adoption, and guardianship relationships. With more than 135,000 adoptions each year in the United States, NTI is guided by the principles listed here. Adoption is lifelong and intergenerational. Loss and grief are central. Secure attachments can be built and rebuilt. Identity formation is more complex in adoption. Race, ethnicity, culture, and class and gender all have unique roles in this practice. And yes, and much more. So we'd like to show you this video of an adoptive parent. Her name is Debbie Shug, and in this video she describes her experience with her children that she's adopted with their first therapist. So we're going to take a peek at this video real quick.
The girls were assigned therapists from their county, which was not the county we lived in, so we had to travel out of county every week for their therapy appointments. One of my daughters, who has a significant history of sexual abuse, was assigned to a male therapist, which I found frustrating because she was terrified of men. But we would take them. We were doing what we were told by the social workers, so we took them to therapy every week, and they each went into their own therapist, and I stayed in the waiting room, and then they were brought back out to me when they were done, and we didn't know any better, so that's what I did. But I'd ask, so what did you talk about? And they said, well, that's confidential. And I thought, oh, well, how can I help them if I don't know what you talked about? And so we would take them home from therapy, and we'd have huge behaviors in the car, and a lot of self-harming behavior for one of my daughters, and a lot of kind of acting out aggressive behavior from the other, but without a lot of guidance in terms of what was happening. It was like kind of this big secret that was going on in there for 45 minutes every week that we weren't privy to. It was very frustrating.
Thanks to Debbie for sharing that. So what did we hear from her? We really heard about this need for services that met the needs of her children and her families that she wasn't receiving. And what the goal of NTI is really this systems change for children and families, for child welfare and mental health professionals to speak a shared language and better collaborate. So through NTI web-based trainings, we really support a common core of mental health and adoption learning that will enhance the ability of child welfare and mental health professionals to speak a shared language. What happens when you don't have the right tools? In this case, soap will not help this person who can't swim. We've worked to support the collaboration between child welfare and mental health to improve permanency outcomes and well-being outcomes for adoptive and guardianship families. NTI provides skills, training, and hands-on resources and tools to use when working with these children and families. So what are some of the benefits of a web-based training? Well, first, this training is standardized. It's portable and can be accessed through multiple types of devices, including mobile devices. It's accessible 24/7. It provides opportunities to engage and reflect on your learning in multiple ways. And it's not trainer dependent. So we've developed, NTI consists of these two trainings. One is a training for child welfare professionals, and the other is a training for mental health professionals. And these are complementary trainings, although not identical. In the child welfare training, there are 8 modules that take about 20 to 25 hours. And in the mental health training, there are 10 modules that take about 25 to 30 hours. The main difference between the two trainings is the focus. So with the child welfare professionals training, this is much more focused on casework practice, while in the mental health professionals training, there's more of a focus on clinical practice and more emphasis on assessment and treatment planning.
So here we have a list of the core competencies embedded into the NTI trainings, both the trainings. And you can see here there's a long list of things that you're probably pretty familiar with if you are working in the permanency field at all. Loss and grief, the impact of trauma, and this is really the complex issues of trauma as it pertains to children who have been in foster care, who have history of abuse and neglect, multiple moves, and so on. Building strong attachments, identity formation, and such. As Emily mentioned, the main difference between the mental health curricula and the child welfare curricula is these last 2 bullets. The assessment and treatment planning and therapeutic parenting strategies are in the mental health curriculum and not in the child welfare. So again, very much aligned, very complementary in nature. Here we have just a few of the interventions that we go over in the trainings: trust-based relational intervention, TheraPlay, the ARC framework, TFCBT, EMDR, parent-child interaction therapy. There's also EMDR, the Darla Henry's 357 model. The interventions that are listed here are not trainings built into the NTI curriculum. They're just a mention of treatment models that have been found to be useful with our population. This is about your toolbox, understanding that one intervention does not work for all children, youth, or families. Resources for additional information on many of these models is included within the training, as are many links to websites and lots of really great resources. This is just a sort of a title slide to give you a look at the format of our training. We're going to drop 2 links into the chat box, and I think Tiara is doing that for you now. You can go to our website, click on these links, and view the demos. There's one demo for child welfare and one demo for mental health. So take a look at those after this webinar is complete, and you'll get more information and actually get a real look at exactly what we're providing in the trainings.
Now we want to provide a brief information with you about the evaluation of the pilot, some of the findings that we had. We had a pilot that was conducted in 9 sites, so 9 state child welfare systems, as well as in a tribal site at the Cherokee Nation, and with the National Indian Child Welfare members, we also piloted the curriculum. And the reason why our pilot site participated, the top 3 reasons include to improve outcomes for children and families, to use data to improve performance and outcomes, and to receive professional training without expending financial resources. So we had some really great participation across these pilot sites. We were really pleased to have over 6,000 child welfare professionals participate and almost 3,000 mental health professionals across these sites. So we got some really good feedback. And we saw the 2 main takeaways from our evaluation that I'll share with you here today is that we found increased knowledge on all core competencies for child welfare and for mental health. So we were really pleased to see that, and I'll share with you some of those numbers. And then also participants reported specific ways that NTI changed their practice. And this evaluation consisted of both qualitative and quantitative components. So first, just sharing with you the findings from the child welfare pilot. We had pre-test and post-test for each module. And you'll see here on this slide that we saw significant knowledge gains from pre-test to post-test on all of our modules, and that the lowest score coming in, so the biggest area of knowledge gap coming into the training prior to the module was on the impact of loss and grief. So we're really pleased to see how that increased because that is such an important, critical part of our work. But you'll see across all of the modules that we saw these substantial gains from pre to post test. And then from the qualitative portion of the evaluation, we saw some thematic areas arise where NTI impacted the practice, the child welfare practice. And that was around recruitment, training, and selection of foster and adoptive parents. Participants talked about improved assessments and referrals. They also talked about improved communication, and as well as this confidence and self-efficacy, that the training really helped build their confidence and self-efficacy. Now on to the findings with the mental health professionals. Again, these are the pre and post-test scores. So those pre-test scores are the blue bars and the post-test scores are the orange bars. And again, those significant knowledge gaps were seen in modules 5, 6, and 7. So those areas around early and ongoing trauma, attachment and child development, and then race, ethnicity, culture, and diversity. And very pleased to see how those competencies rose significantly after the module content. Again, in terms of the impact on mental health professionals, they talked a lot about themes around these 2 areas emerged around their increased competency and knowledge. And so really talking about increasing their competency, improving and reinforcing skills, also talking about how this was relevant beyond adoption, so working with immigrant families, with families experiencing divorce and other types of separation, working with clients, and then also increasing awareness of adoption issues. And with knowledge, it really built cultural awareness, really more knowledge around grief and loss, trauma, and the importance of incorporating parents in this work.
So what's the buzz? Don't take our word for it. Here's what a few of our NTI participants have had to say. So from Minnesota, the training gave broad fundamentals of identity formation, attachment, diversity, and culture. But then it also gave specific tools such as activities or ways to communicate with youth in each of these areas. At the end, you were really able to understand the why as well as implementing the how.
And from a child welfare leadership, we heard, here's a quote from one of them that says, "NTI is the most concise training I've seen for child welfare staff ever. It gets at the heart of the work and really gives hands-on tools for staff to use in supporting children and families." Also from the field of mental health, a supervisor told us, "My team felt the NTI training is very beneficial and applicable to their jobs. It was evident that the material was evidence and research-based with practical interventions that can be implemented."
So throughout our evaluation process in the pilots, we collected a lot of anecdotal information, a lot of comments, along with the data. The evaluation included a satisfaction survey, and we were really happy with the results, as you could see here. 90% of our participants were extremely or somewhat satisfied overall. The level of difficulty, folks were satisfied about 79%. And, you know, again, really, really great levels of satisfaction for this training, and we were very, very pleased. I think the best testimony to the efficacy and value of the training is that 100% of our pilot sites have decided to sustain the NTI in their systems in some way. There are different ways that they're doing that, from requiring NTI for adoption and permanency staff to requiring NTI for all child welfare staff. In some of our sites, it's being embedded in new staff foundational training. In some of our sites, they're actually modifying existing training that they provide throughout the state to incorporate NTI. We've seen a lot of partnerships across the country between public and private providers, again, creating that shared language and common understanding of adoption issues. It really makes for better collaboration, and what we're finding is better long-term outcomes as well. And some of our states are modifying their contracts to require the training for all their behavioral and mental health providers.
So that was just a small sampling of the testimonials and the evaluation results that we had. If you would like to hear more about the evaluation, see more testimonials, hear from more of our sites that participated in the pilot, please do go to our website where we have lots of reports and downloadable material.
And also videos. We have video testimonials on there as well. There's lots of great information on our website for sure. So let's hear again from Deb Shug. This time she's talking about the difference of working with an adoption competent therapist.
To say it was like night and day is an understatement. We had a therapist who was an absolute godsend. She really understood all the nuances, all of the complexities of adoption, of children growing up in a family they aren't born into. She had personal and professional experience in adoption. She had specialized training in the issues surrounding adoption and permanency. And so she really, really got it. And for starters, she included me in the therapy. So we were in there together, and she was helping to kind of coach and facilitate me doing the healing with my kids, because she recognized that I'm the one, and my husband is the one, who's living with them 24/7. And they're not going to just heal during that 45, 50-minute session once a week. But we started doing a lot of attachment work, which I didn't understand at the time. I didn't really know what it was. I can remember having some of it feel kind of awkward and not knowing quite how to do some of that stuff with lotion on my little girl's hands and holding her like she was a baby. And I'm like, really? Is this really what we're supposed to be doing? And she's like, yeah, trust me. But I did trust her because I saw the difference. She really got it, and she understood when my kids were sharing something that was happening and I knew that their version was absolutely not accurate. She taught me how to just weight with that, and that to trust her, that she knew what she was doing. It didn't mean that she believed what they were saying, hook, line, and sinker. It meant that she was getting lots of other helpful information about how they were feeling by the way they were describing it. So she taught me a lot. She taught me not to talk so much. She's like, no, Debbie, you didn't talk. No, the kids are not learning through your words. She spent a lot of time checking in with me when we'd first go so that I could, cry or rant or brag or whatever it was about what was going on that week. And then we would welcome my child into the room, and then we would do that family work together. But I largely credit her with keeping our family together, because we had some very, very difficult times with some really, really big behaviors that I think would have unraveled a lot of families. But having somebody who really got it and having a safe place to take that without being judged was hugely helpful.
So I love Deb's comments about not feeling judged, what a difference that made to her. Being a part of the therapy that her children were in, instead of just coming in at the end and not really knowing what's going on, really, really important pieces of the NTI training. So right here we've listed some of the NTI goals. We've created these trainings to closely align with the Children's Bureau's vision for changing child welfare practice in all these areas. And I think that we've done a really great job. NTI has the potential to prevent reentry into the foster care system and or to help to prevent the dissolution of adoptive placements by really helping people to have a better understanding of what's going on with their children and with the families, providing adoption-competent mental health services. NTI is appropriate across the continuum of services. If staff on the front end have a better understanding of the experiences of children and the impact of loss, grief, trauma, etc., they can better support families from the beginning and prevent unnecessary and inappropriate placements into care. Let's think about how this might benefit you. How can NTI improve your practice? Well, what we've seen throughout our pilots is enhanced collaboration between public and private sector, even between different units in the Department of Human Services, between adoption and foster care, from CPS workers to foster care workers to adoption workers. Enhanced casework practice. How are we talking to children? One of the things that came up in our training was a couple of people who mentioned that they didn't know that they could talk to the child about why they were removed and brought into care, and how profound that conversation was with the child once they realized that not only was it okay, but it was healing for the child to know that. Improved assessment skills and strategies. What's going on with the child, with the family, and how can we help to support the permanency and the healing? And for those who are working in the private sector, perhaps as a private practitioner, the development of specialty clinical practice, I think, is really valuable. I know in our community we have a real lack of professionals who can address the complex mental health needs of children and families who come to us that are in adoption, foster care, or guardianship families.
So we get a lot of questions about who should participate in NTI. The mental health curriculum was designed for agency, community-based, and private practitioners to provide foundational knowledge to more effectively address the unique adoption-related issues that arise throughout the lifespan of an adoptive, guardianship, relative family, or even through a birth family reunification. This is for those that work in that clinical capacity. So you don't necessarily have to be a licensed professional to take this training. You may work in a different type of clinical role. The child welfare curriculum is designed for professionals working for public and private child welfare agencies. This training, as I said, is more focused on casework, whereas the mental health professionals training is more focused on clinical assessment and clinical treatment. The training can be relevant for staff beyond just those working for adoption. As we learned in the pilot, a lot of staff throughout the child welfare continuum may benefit. So you could consider including those who work with children in foster care that are preparing for adoption and guardianship, working with families preparing to assume guardianship of a child. This is also appropriate for families preparing to adopt a child from a private domestic or inter-country adoption, and for adoption and those working with adoption and guardianship families post-placement or post-finalization. In some jurisdictions, we even had those on the child protection side, so doing investigations of child abuse and neglect participate. And one of the main reasons is the importance for everyone across the continuum to understand what the effect is of a child being removed from the home or moving placements and the importance of those birth and family connections.
We've also had CASA workers, attorneys, school guidance counselors. So again, as Emily says, across the continuum. And a few moments ago, I noticed there was a question in the chat about taking, could you take the parenting strategies portion of the mental health program if you're not working in a clinical setting? And what I would say to that is you get to choose which curriculum you would like to take. You could take the child welfare curriculum, or you could take the mental health. You would want to complete one or the other, or if you like, you could do both. So it's really up to you to decide which is going to fit best with your focus and your practice.
And again, our website has a lot of helpful information about the details of each training module and what's covered in each training module. So you will see that the Child Welfare Professionals training also has parenting strategies and other things embedded throughout. It even has assessment strategies and what are the appropriate clinical interventions embedded throughout. So please do take a look again at our website and some of the details of what's within each module. Those who complete the NTI training will receive a certificate of completion that outlines how many hours and that they took. Currently, NTI is not a certificate program. Therefore, completers cannot say they are certified adoption competent, but they can say they have received specialized adoption competency training.
In fact, in a number of our states, they are developing lists of professionals who have completed NTI so that families can find someone for themselves, like Debbie Shug did, who has adoption competency training. So this is the fun part. NTI is free. And I'm going to tell you what we mean by free. So as Emily mentioned at the beginning, this initiative was funded by the Children's Bureau, and we have free access to NTI via CapLearn. It's Children's Bureau's training website. It's also possible to upload this into your agency's learning management system, and then there's an enhanced option through CASE LMS. If you're interested in more details, and actually Emily's going to share a few, but certainly contact NTI admin at adoptionsupport.org, and we will put that into the chat box for you as well. We can give you more details pertaining to your specific situation.
So as Lisa mentioned, there are some options for how the training is accessed. Again, the training is free. So the training can either be accessed through the Federal Children's Bureau Learning Management System called CapLearn, or through your own internal learning management system. So the training files will actually be available and be able to be provided directly to your system. The third option is to work with CASE to use our LMS here. And the benefit of that is just some more enhanced features around the actual training system, the look and feel, some data access that's not available through CapLearn. So if you are interested in any of these three options, please do contact us for more information, and we'd be happy to talk more with you about those. Implementation, support, and guidance is also really critical to the success of NTI. Even though this is an online, on-demand access training, you really need to think about how you might roll it out in your staff, with your staff or agency. Careful planning is needed for the training to be successfully integrated into practice. And the types of supports you really should be thinking about that are important is to plan for not just the implementation, but also transfer of learning elements, as well as supervisor coaching. And so again, for more information about how CASE as an organization can support you with that, you can contact us at ntiadmin@adoptionsupport.org. adoptionsupport.org. And that email address is also being dropped in the chat box and will also be available on the last slide.
So how can we help you implement NTI in your state or agency? You know, every site might have a different need or a different idea about how to do that. Emily and I are here to assist you and help you sort of think through the process. If you are interested, again, contact us through the email ntiadmin@adoptionsupport.org. So again, we'll have that dropped into the chat box so you could see it. Also available on our website. And I think what we'd like to do now is try to answer some of the questions that have been coming up, and we're gonna look through these and see if we can get through some of your questions. And if you have other questions that you haven't put into the chat box yet, please do drop them in, and we'd be happy to respond. So let's see here. One question here says, would the therapist training be appropriate for therapeutic foster parents? Would those without advanced human service training understand the material presented? So two things about this. Would people without an advanced degree or training be able to understand it? I would say they probably would. However, NTI is designed specifically for professionals who are working in the field. We are exploring additional funding to modify the curriculum to be presented directly to foster and adoptive parents. There also are just a plethora of materials embedded in the training so that any of your staff can, when they take the training, immediately download the resources and then take that to take it to your parents. Let's see. What else have we got? So let me see if we answered that question. You let me know if we did not. Emily, if you can you scroll that up a little bit so I could see? There will be a recording of this webinar. It will be emailed to each of you, and it also will be available on our website. The 9 pilot sites, there was a question there. Okay. So the 9 pilot areas, did they have current struggles with adoption, guardianship disruptions, or reentry into the foster care system? I would say that was pretty common across our sites. So yeah, I mean, I think in most of our sites there was a lot of struggle, and based on the CFSR, sorry. So a lot of our sites identified that a lot of disruptions, a lot of disillusions, a lot of difficulties with finding families for children. I think this question also asks about identifying appropriate adoptive families, and a number of our sites have also used this for training the adoption foster care licensing teams, so for recruitment and retention purposes. If they feel more competent and have a better understanding of the mental health issues for the children, then certainly they feel like they could pass that on to the families as well.
We have a question here about CEUs related to LMFTs and other licensure disciplines. This question comes up a lot. So we will have NASW certify this training. And I know for a lot of you, you are not social workers, that you might be interested in taking this, although we have found that in a large amount of states, the LMFT boards and the other licensure boards will accept NASW certified CEUs. So this might be something to check in your state. We're also looking at other certifications as well. And someone asked, when will the training be ready to access? It's launching nationally September 30th. So it will be on the CapLearn website there and ready for your access.
And anyone who's signed on will get an email just notifying you, reminding you that this is now available. Okay. Let's see, there was another question about, let's see here. Do we have any feedback from RAP facilitators on the inclusion of this in their knowledge base? You know, again, in our sites, this has been used for many, many different disciplines across the continuum. So from, as Emily mentioned, from CPS, and, you know, like from entry into the foster care system all the way through post-adoption services. And I think it absolutely would be relevant to RAP facilitators. Let's see, more questions?
We have a couple of questions from a little earlier in the presentation, if you don't mind, and I can go ahead and repeat them for you all. Is that okay?
Thank you, Tiara. It's helpful. We're just scrolling through and trying to find them. So if you've noted them, that would be really, really helpful.
Awesome. Okay, so we have a question from Karen. If a worker is not a therapist, can we take the part of the therapist that deals with parenting strategies?
Yeah, so I think, again, it would be important to look on our website at all the different descriptions and the details of each module to decide which one is most appropriate for you. But again, you can make that decision if you think the mental health professionals one would be more appropriate based on some of that content around the positive parenting strategies. But I will say, again, embedded throughout both curriculums, there is similar content about interventions that work with this population, that have been found to work with this population, about assessment, and about parenting strategies. So both of the trainings will have that information. I also saw a question about for clinicians, will there be information on the child welfare system and entry into foster care and adoptions? And yes, absolutely, that's a piece of it, is really that systems change. We need child welfare to also understand the mental health side as well, and so it's really cross-communicating about each of those systems.
Yep. And then I saw a question about when the training launches, how will you know where to access it? So on September 30th, the training will be available on CapLearn. And Tiara, if you could put that website up, that would be really helpful. Also, we will email the links to anyone who's participated in any of our webinars. We've been doing webinars and conferences across the country for the last year. If your system is interested in integrating this within your system, so say you are working in a child welfare system or a behavioral or mental health practice or entity and would like to implement this in your own LMS, again, please give us a shout, and we will help you do that. So for everyone, it will be available through the CapLearn, and if it's available through a different system, your system we will work with that system to craft a communication plan so you know where to find us.
We have a question about if we participated in the pilot program, will we need to take the training again, or is it the same training? Great question. So this training, this version that we're releasing, is an updated version from the pilot. So there are differences, and particularly on the child welfare side, there are quite a few differences in our supervisor lessons and sort of how we communicate that information. So it's updated, the look and feel is different. I will say though that the content and the learning objectives and learning goals are the same. So if you need to take it again, you know, if you want to access the training again and access some of those materials, you will need to go on and set up a new profile potentially to re-access, but it also doesn't hurt to retake the training. Something that we've really done throughout this is embed adult learning principles, and so, you know, a review 2 years later of that content and kind of revisiting that content is a great refresher. That's something that we all need as a part of our learning and development.
And I do believe, and you know, we can get clarification on this, but I do believe that if you already have completed the NTI, whether it's child welfare or mental health training, you are able to go back in and access any of the materials and any of the modules. So you don't necessarily have to retake it, but you can, do you think? So we're not clear. We'll get that information and we'll figure that out and get that to you. Other questions? Tiara, have we missed anything?
I don't see any additional questions now. I'm just going back through and looking through our list.
Did someone address having a certificate of completion? Okay, so there is a certificate of completion. It is embedded in the training, so when you complete the training, there is a way to download your certificate and print it. But you have to complete each module and pass the post-test in order to get that certificate of training. Oh, there, Don is chiming in here. There's no requirement to retake it unless your agency requires it. Okay, you don't have to take it again.
Okay, so we do have a question from Danielle. She says that I will be managing a cohort of MSW interns this fall in an outpatient clinical setting. I am hoping to compile resources to help increase their confidence in their skills. Do you think this training will be helpful to them despite them not having any direct practice experience with clients?
Absolutely. It would be fabulous. We really believe that training folks at the very beginning of their practice will help them walk in the door with great understanding and knowledge and will really be able to make an impact from the beginning. I would suggest that if you are leading a mentor group, everybody will need to log on. If they want a certificate of completion, will need to log on to their own computer to do it. But in many of so that they get their own login and their own certificate of completion. In many of our pilot sites, folks did this. We walked into a training room or people brought their laptop computers into a room, worked on the training together, had time to discuss the different components, and really felt it was an excellent way to utilize the training and incorporate transfer of learning practices into the training.
Yeah, great question. We really think MSW students are a great audience to take this as they're going into their practicum and learning to work with clients. I see a question about wondering if my intern will have time to complete it before she leaves the work site, and another question about if anyone can access this. So this is online. So once it's online, it will be available for anyone wanting to access it, and then that would include your students. So let's say your students start on it, but during their practicum, maybe they don't finish, it's a short period of time, they can still use their login to go back to it later and finish that at a later time, off-site or once they're done with the work at your agency. I would say just make sure they use an email address that they're going to be able to continue to use. So maybe if your agency only gives them an email for 4 months, have them log in with a different email address that they can revisit and so that they can go back to the training.
Yeah, I think the time period is it's a really good question. In what time period does the training need to be completed? There actually is not a time frame that we set as a requirement. We do suggest a time frame of 4 to 6 months, just based on adult learning principles. If you sort of take your time and push it out and figure you have until the rest of your life to complete, you probably won't complete it just because other priorities pop up. So we recommend 4 to 6 months. It's a lot of hours, and we recognize that and understand that. And also really believe that it's worth the time. So, in different sites, managers have provided protected time, quiet space, put aside a couple of hours a week, that kind of thing, in order to complete the training. And, the other thing is, I think for personal professional development, this is a great tool to have in your tool belt and a really great training to take. And you know, if some people need to complete it on their personal time, I think it's a very a very great use of their time as well.
So we hope that this webinar really got you interested and excited to use NTI in your work. As we said before, a recording will be made available, and I think some people had issues with the PowerPoint download, but there is a link in our chat box to download the PowerPoint. Please do feel free to follow up with us and email us at that email address you see on the screen, but we just want to thank everyone for joining us today. And please spread the word. We're having a couple of more webinars to introduce the initiative, so if there are others you think this would be a benefit to them, please do spread the word, and we'd love to help them learn more about how to access NTI. Thank you, everyone.
Thank you so much.